Good evening, everyone. Welcome. Good evening. Hello, everyone. Just starting my video, little technical glitch. Thank you very much to our host for reminding me for that. It's 5 o'clock and I see we have participants joining in high numbers at this moment. So we're going to get ourselves started. Welcome to CCI Eastern Ontario's first virtual town hall, our superhero edition. I am Nancy Houle, one of the 9 directors of CCIS Eastern Ontario and current president, a condo lawyer and your moderator for this session. The Canadian Condominium Institute is an independent, nonprofit organization formed in 1982 with chapters across the country and 8 in Ontario alone. Today, we have over 200 people registered from across the province and various CCI chapters, and the questions we are putting to our experts today come from our community, our registrants. We welcome you all, and we hope that today's session will be helpful. We have all been living with the reality of COVID-19 for over a month now. The Ontario government initially declared a state of emergency on March 17th, and this week, the government extended the state of emergency for another 28 days until May 12th. Within this state of emergency comes various orders, which we have all become familiar with and which are now being enforced by various levels of government. The essential services list has been restricted. Open houses are currently banned. Short-term rentals booked after April 4th are currently banned, except for those who are in need of emergency housing. And these restrictions are currently set to be in effect until April 23rd and may well be extended. These restrictions have addressed some of the issues that condos are struggling with. The COVID modeling we have seen to date has shown the importance and positive impact of people staying in their homes. Leaving your home except for essential needs is discouraged as we all fight together to crush the curve. However, in condominium settings, this presents unique challenges and considerations. To that end, I am honored and delighted to have 3 exceptional local superheroes with us this afternoon to provide us with some guidance and insight for our condominium community as we navigate through these unprecedented times. Today, we're going to hear from Dr. Vera Etches, Medical Officer of Health, Ottawa Public Health. We're going to hear from Mark Ford, Superintendent of Frontline Operations. And we're going to hear from Division Chief Gwen Lewis, Ottawa Fire Services. Before we begin, a few brief reminders, and then we're going to get to our first featured speaker, Dr. Etches. We are recording this webinar, and it will be later available on our website. We will not be taking questions live, but you can type a question using the Q&A function. At the bottom of your screen, you will see the Q&A icon. If you click on that, you can type a question, and our dedicated board members, Justin Tudor, Shelley Seavey, Richard Elia, and Andre Ball, will do their very best to get your questions and comments. If we don't get to all of your questions, we will do what we can to obtain answers following this session. The information you're being provided today is general information. Things are changing fast, and what to do in your specific situation is often fact-specific. It is very important, now more so than ever, that condos rely on the various professionals for advice in these challenging times. If you are a director and want to use the protection of Section 37 of the Act, you need to get an opinion about your specific fact situation from the professionals. This webinar and the answers in the Q&A are not intended to provide you with opinions that would protect you under Section 37 of the Act. In addition, the information provided in this webinar is current as of today, April 16th. As things are changing rapidly, the information provided today may not be relevant or applicable at a future date. So without further ado, let me right away move on to our very first local superhero who has become a household name. Dr. Vera Etches' extensive bio is on our CCI Eastern Ontario website, and I invite you to peruse it, as it would take me quite some time to enumerate her many, many credentials. As the Medical Officer of Health for Ottawa Public Health, Dr. Etches has been guiding our community through this crisis with her calm and steady and effective information and messaging. She is also an adjunct professor at the University of Ottawa, where she supervises medical residents in public health and preventive medicine and family medicine. Dr. Etches, we welcome you and thank you so much for taking time out of your exceptionally busy days to join us here today. If you agree, I say we'll dive right in. So the first question that we have to pose to you, Dr. Etches, talks about quarantining and returning travelers. Many of our Ottawa condominium communities have seen returning travelers, whether from March break trips or snowbirds. These travelers are aware of the requirement to self-isolate for a 2-week period in most cases. However, some of them may under the impression that it's okay to leave their unit for reasons such as laundry or garbage removal, medication, food delivery, walking the dog. We were welcoming your thoughts on whether this is permitted within the self-isolation guidelines.
Thank you for the question. You know, it may have been hard for people to keep up with some of the changes and the restrictions that have become, you know, stronger and stronger. It is a federal government act, the Quarantine Act, which is what applies here. And in fact, it does mean that people are not meant to leave their premise. And there was a renewed order that actually now involves people when they come into the country having to identify.
We just lost you for a quick moment. Hopefully we'll get your feedback really quickly. If not, we might need to cancel just the video portion to get the audio.
Okay.
Oh, no, you're good now. Go ahead. Yeah.
Okay, sorry, I've been using this all day. I hope it continues. Just to say that there's a new, even stronger order under the Quarantine Act, which was now going to require anyone who enters the country to prove that they can stay on their property, that they have somebody to help them with groceries, that they have somebody who can look after their dog, because it really is meant to be about staying within your space and not.
We just lost you again for a quick second. We'll just give you 1 second. Oh, we're good now. Go ahead. Yeah.
The request is for people to identify others to do those tasks so that they don't have to leave their building.
Okay. So in the case of a condominium setting, then if I'm thinking about a high rise or a mid rise, that would mean staying within your unit and not going to the garbage chute, not going to walk your dog, getting somebody else to do those services for you.
That's
Great.
correct.
That's wonderful guidance. Thank you very much. Moving on again to a situation we see in multi-dwelling high-rise units. In the Ottawa region, we have several multi-dwelling high-rises where an occupant may come into close contact with other occupants, such as when riding the elevator, using the common laundry facilities, or the garbage rooms. I've seen some videos or clips about the elevator with the 2 X's. But I do know that we've had situations where residents have been a little cranky with others when asked to not go in the elevator. So do you have any advice or any additional thoughts on safety precautions that you could be taking into consideration when accessing these types of common element areas?
We will share with you an elevator etiquette poster that we've created, so you can distribute that to your members. It is important to avoid overcrowding. So if somebody can take the stairs, you know, to take the stairs.
I just lost you again. I wonder if we should maybe mute your video for a second or stop the video. Oh, go ahead.
If the elevator is already occupied, then it's important to try to maybe wait for the next elevator if you can. You know, maintaining two meters apart in an elevator is pretty challenging, but you can go to the opposite corners. The other thing is the hand washing and being very aware that you don't touch your face after you've touched the elevator button before you wash your hands or use hand sanitizer, because these commonly touched areas, you know, are a risk. I think you had asked also about laundry facilities, and actually there is some guidance there as well. We can share. It's the National Collaborating Center for Environmental Health, actually, but they're basic things. They're talking about making sure before you enter the laundry facility that you wash your hands to protect others. Make sure when you leave, you wash your hands to protect yourself. Again, try to keep that 2 meter distance from others. Also, before you put your clean clothes back into your laundry hamper, think about whether you can disinfect your laundry hamper. And then wipe down the controls of the machines. So anything you've touched to be able to wipe those down after your use is also important.
Those actually would be incredibly helpful. What we could do is post them on our website, and condos could post them in main areas of their lobbies, in their laundry rooms, etc. Do you have any thoughts on garbage chutes, or I guess the same measures would apply?
Yeah, if you can think of it's whatever you touch or whatever's commonly touched should be cleaned more frequently. And for the individual, don't touch your eyes or your nose or your mouth afterwards, because that's how the virus gets in. If you have it on a surface and then you touch your face, that can be how people become infected.
Great, thank you, Dr. Etches. So for our participants, we will post that information as soon as we receive it from Dr. Etches, because it will be most helpful. So I do see we have a question with respect to our first question we talked about, but I think we'll bring it up a little bit later because it's also relevant to a further question we have. Certain condominiums have an increased number of elderly occupants. How best, in your view, could healthcare workers, caregivers, and family members continue to care for these individuals under the current circumstances while maintaining proper physical distancing? Do you have any helpful hints on that?
So trying to maintain the physical distancing. So if somebody's coming into the building to care for an older adult, then to do that in a way that respects others' space. You can also think about if it's too difficult to maintain that distance from others, wearing a mask, because that can help keep your secretions to yourself. So we're recommending masks be used where physical distancing cannot be maintained. Obviously, the hand washing before and after you leave is important. And this is important. People do need caregivers, and we want to validate that is an acceptable practice. Also, something on this subject that people might not know is that if you have a caregiver who gets sick, who's not a formal healthcare worker, but your family member or even friend who helps, those people are eligible for testing for COVID-19. They can present to be tested in the province of Ontario. It'll be different in different places, but usually there's an assessment center or a way to get tested for COVID-19. And the government has said,
Just give our system a second to catch up, because of what you're saying is very important and we don't want to miss that. I think it'll catch up in just a moment. Just give us a second, folks. Okay, go ahead. Yeah. We missed part of it. You were just saying that there's the government may have a faster turnaround or something for care providers. I'm not sure if that's where you were going.
So the government has opened up the eligibility for testing for COVID-19 to informal caregivers. So it'll be different in parts of the province, how you access that testing. Usually there's an assessment center. But if you are a caregiver and you cough or something else that you think could be COVID-19, then it's important for that person, yourself, to be tested so that it's not COVID-19, hopefully, and you're able to continue to support your loved one or the person you're caring for.
Great, thank you. And I know one of those testing facilities, I think, is at Brewer Park, and there's some in Winchester and other regional areas. And there's one in, I think, the West End as well, if I'm not mistaken. Okay, great. So we'll turn on to our next question then. This is an interesting situation we're seeing in our high rises as well. In certain condominium settings, there's volunteer owners assisting those in need with tasks such as laundry, food, and medication deliver. So it's a group of volunteer owners that are in the complex. And we have individuals who are in quarantine situations and they're assisting with that care. Do you have any protocols or suggestions, particularly on the point of drop-off or delivery, that you can think could be helpful to assist our volunteer groups in maintaining the safety of both the volunteers and the recipients?
Yes, so the principle applies of trying to keep 2 meters away. And so if it's something you can drop off, to set a designated time for that drop off, or to knock on the door and then back away. I think that that's important. Also, where the basics really matter. So making sure that that volunteer is washing their hands, and very conscious of that. You know, if they're touching things that are going to go to somebody who's more vulnerable, and vice versa. If they're picking things up from somebody who's in quarantine, to just be aware of the hands as a possibility for transmission. And so again, asking people to wash.
Just lost you for a quick sec, but I think you were just about to say again, making sure that everybody is washing their hands very effectively. And just when you come back, I'll ask, I guess, whether you think it would be important for our volunteers and those who are being serviced to wear masks as well. Would you recommend that?
It certainly is. I can't say don't do that. It's an added layer of protection. Yeah, it's most important to maintain the distance. So, you know, if you don't have to come face to face with somebody, if you can figure out a mechanism to just leave things, then that's better. But if you are going to, then wearing a mask.
Okay, and maybe I'll jump to another question that is pretty much on that exact point about the distancing and about some thoughts on that. Some condominiums, of course, have seen increased food. Many condominiums have seen increased food deliveries, medication deliveries, Amazon deliveries. So we have different situations in different condos. Some condos have all the deliveries at the door or have a room set aside. In other condos, the delivery people are going through the common elements and up to the units. And we were interested in your thoughts on whether you had a best case practice on whether it should stay in the lobby or whether it going to the unit is okay. Is there a way that is either one better for decreasing transmission?
Well, we would recommend that people avoid others entering the building as much as possible. So we would like to see that that anyone who comes into the building, it's more of an essential activity. So we are asking people to think about whether that's required, or you know, is it an essential repair, or is it something that could be delayed? In terms of deliveries, again, the more you can minimize people walking through common spaces, the better. So that again, if people are able to meet the person who's doing the delivery at the front door, that would be ideal.
Okay, so keeping, to the extent possible, keeping the delivery of goods within the common element lobby area or the front area, as opposed to minimizing going up the elevators, etc. Okay, very helpful. And the next question, as previously mentioned, some of our condominium communities have an increased number of elderly or at-risk populations. In the event that a particular condominium corporation experienced a high level of cases, is it possible that Ottawa Public Health could consider a lockdown of that particular building? Like that particular.
And, we haven't seen this yet in terms of a cluster of cases within a condominium building, but we're on the lookout for that. So every laboratory confirmed case gets reported to Ottawa Public Health, and then we investigate all of the places that that person has been, including in the 48 hours before they knew they were sick, because unfortunately one of the challenges with this virus is it can be transmitted in those 48 hours before people even realize they're sick. And so we go through every minute of their day. Where have they been? Where, who else could have been in contact with them, in close contact, meaning, you know, within the household, within 2 meters for a time. And that, you know, could lead us to identify common risk in a common location like a condominium. And then we would want to work up you know, more measures that might be important for the building in terms of more cleaning, looking at practices that would decrease the times people are going to be connected in the building. We do hope that people have already put signage up to decrease and you know, stop the use of gatherings in common areas, you know, gyms or pools or these kinds of things. But we would work through that. We would look at what are the particular risks in that building, what can we do to increase infection prevention and control. Lockdown is a kind of word we don't typically use. I wouldn't say that.
It's a dramatic word. Sorry about that. Yeah.
What we do is if it's a high risk exposure, if there's somebody who's a contact of that case or cases, then we would, if it's high risk, ask them to self-isolate. So we would ask the individuals who are close contacts to stay in their area, in their unit, and that would be, for the 14 days after somebody was exposed.
So I guess if I'm hearing you right, Ottawa Public Health would be very proactive in working with management and the board of directors of a particular at-risk building to try and help them through this type of a crisis.
Yeah, we always pay attention to privacy. So we would not talk about an individual case's name or, share any information that wasn't required to manage the risk. So we might not reach out with those kinds of details, but if we needed to work with somebody in the building about some building issues, we would do that.
Okay, I guess, and that leads me directly into another question that is a hot topic. If a resident is diagnosed as COVID-19 positive, there is no legal obligation on the resident themselves to let management or the board of directors know. So there is some concern in the condominium community that there could be a resident in the building who hasn't told anybody. Given the close proximity at this stage, would Ottawa Public Health consider letting the community know that there's a case in the building, perhaps not disclosing the exact name, but reaching out to the board or management so that you could proactively work with the condo to deal with the situation?
So that would definitely be on an as-needed basis. If the investigation of the case and thinking about the contacts led to a need to take some action in the building. We have the nurse that interviews each case makes sure, again, that case, the person, it seems funny to call a person a case, but that person understands that they then cannot leave their space. So it's like the people under quarantine, they have to find somebody who can get them the things that they need outside of their space, groceries and medications and that kind of thing. So that it's self-isolation if you have a positive test result for COVID-19. And so we work through that with the person, make sure they can do that. If there's challenges that make us think that we need to involve others, then we would.
Okay, that's very helpful, because that leads back to one of the questions we've had on our Q&A, which is, does this mean that if someone is required to prove that they have assistance remaining in their unit, who would they have to prove it to? So it's working with public health. They have to show public health that they have these tools in place. And then if public health thought that there was a need to involve members of the building, the board of directors or management, you could reach out in that particular case, perhaps. That makes sense?
Yeah, I think we always will be very careful with privacy, and,
right.
So yeah, just the first case on the Quarantine Act is actually as people enter the country, so it's the quarantine officers that are asking at that point
to make sure that they have individuals who are going to take care. Okay.
Yeah. But when it comes to a positive case, then that would be public health. There was something else I wanted to say. On that. Oh yes, if somebody's challenged, we don't expect the condo board to help them with the basics of life, right?
That's a difficult situation.
We have a system to support people who have needs through the city of Ottawa and probably in other cities or villages, towns.
Okay, so I just lost you for a quick second, but that does provide some comfort to our board of directors and management as well, that they can lead those people back to public health and say, we're aware that public health has resources and help that they can direct you to assist you with your living situation while you're in quarantine. Would that be correct?
Yeah, so as public health can link people, so
Okay.
we ourselves are not taking care of social needs,
Mhm.
but the cities or the social services departments that serve an area are.
Okay.
They're looking at, they have networks of volunteers and others that can help.
Great. We have somebody in our chat who's asking about the masks and they don't know where to purchase masks. We're definitely seeing lots of homemade videos on masks. And I guess if we go back to the question about wearing masks, are the homemade masks better than nothing?
Yes, it seems that there is evidence that if you can use anything, if you can use a scarf, to cover your face, that probably keeps some of the respiratory secretions from posing a risk to others. It's not going to be as good as a medical mask. And you do want to make sure you still keep clean hands. So wash your hands before you put the mask on. Still think about the hands as important to keep clean, and then make sure you're not touching your face and on stuff under the mask. Make sure that you wash your hands again when you take it off. I have heard this. It's hard for people to find a source of masks, and so that's something my team is looking into to see how we can help people identify sources of masks. I know there are volunteers making masks. There are
Mhm.
trying to help provide that supply because it's not something that we usually have. Excuse me, but that is also on our website. We have details about using masks, about even making your own mask out of a t-shirt if you wanted to do that. So we can send you the links to our website afterwards.
Fantastic. And your Twitter feed is excellent as well. I follow you on Twitter and you have all sorts of fantastic ideas on various options for that too. So I could recommend to our participants that they also follow you on Twitter. So if I look outside up here, we have a little bit of snow coming down, but spring is apparently here. And with that brings a desire to garden. And again, we have various different situations. We have townhouses where people have backyards and they can go out and garden. And then we also have situations in high rises where one individual may want to go outside and garden, which could lead to others. So we were welcoming any thoughts you might have on whether individuals should be permitted to garden on the common elements.
I would suggest that each facility makes some guidelines for their layout, for their unique situation, and that the guidelines keep in mind that you're aiming for that maintaining that 2 meters distance between others. So if you can set up a schedule for gardening in the common spaces that keeps people in their time slot, not there at the same time, that's one idea.
I'll just give your feed 1 second to catch up to us here. We just lost you for a quick moment. Oh, you're back. Go ahead. Yeah.
Sorry about this. That must be
That's
very
okay.
frustrating to
No,
have a break up all the time.
it's the way of our work home situations, right? So that's just fine. That's just fine. You were just recommending a scheduling for people?
Scheduling for people to not come into contact with each other, also to avoid use of common gardening tools.
Oh, right.
So that if people can have their own gardening tools, that prevents people from touching things that other people have touched. We think that it is important to get outside. I think it's very good to be involved in gardening for your mental health. So it's setting out some guidelines for that based on what your facility looks like.
Okay, and on a similar vein, with no access to fitness rooms, because I think you'll be happy to know that every condo I know of has shut down their facilities, has shut down their gyms, has shut down their pools, have shut down all of their common element area rooms on the recommendations of the various levels of government, which is great. But with no access to fitness rooms, we are hearing of some residents taking to using common stairwells for exercise, running up and down the stairs. Just wondered if you had any thoughts on that.
Well, I appreciate people want to be physically active. That's great for health. I would say that the stairwells are probably pretty close quarters. They probably do make it harder to practice physical distancing, especially if some people are trying to take the stairs
just go ahead. Yep. Sorry, we lost the last little bit of what you were saying. So if, you were saying that it could be hard for physical distancing if some people are taking the stairs, I guess, for natural egress and ingress.
Because the elevator is close contact, and more people in the stairs, it might be harder to maintain physical distancing and doing your exercise there. Also, the railings are commonly touched surfaces. The door handles are commonly touched surfaces. So you do need to think about frequent cleaning in those common areas, and always be thinking about, again, whether your hands are contaminated. So I advocate going outside when you can, that the fresh air is good for us. It does make it easier to physically distance because you can cross the street and there's fewer things to touch outside.
On that same vein, we saw a lot of discourse over the past couple of days about going outside and about having a beer with our neighbor at the end of the driveway. And we're seeing these types of things happening in the condo setting as well. For example, neighbors might be out in their backyards and not realizing that they're less than 2 meters apart because there's only a fence separating them. So again, we were wondering if you had any particular ideas on outdoor backyards, any suggestions that you've given to other vicinities where they've got close quarters and backyard areas.
Well, I want to start off by saying it's great to keep in touch with neighbors. Neighbors are a source of support, want to maintain good relations with our neighbors. So I appreciate that. And it's good to check in. Sometimes if you can check in virtually, that's safer. And then the 2 meter distance is important because it's how far the respiratory droplets can spread when you're, coughing or sneezing or singing or speaking loudly or shouting. There's a certain distance that the droplets can go. And so I can imagine in some condos, the fencing might not be a sufficient barrier. Just talking, over something that's maybe a chain link fence or, not a board. So it's compared to a window, like, it doesn't provide a firm barrier to the spread of respiratory secretions. So I would say if you think you're within 2 meters of a neighbor, you could also be wearing a mask, so that adds that extra layer of protection. Just like when you go to a grocery store and you can't keep 2 meters away from somebody else, wearing a mask is a way to protect others.
Okay, great. We had an interesting question here. If a person has recovered from the virus, do we know yet if they can get it again?
I would say we don't have a definitive answer yet. It's something people are very interested in studying. People talk about a serology test, which tests the blood test that tests for immunity to the virus. And there are some that are being trialed around the world. People want to be able to measure antibodies to the virus. And usually if you have antibodies, you're immune for a period of time, and then that immunity can wane. With other respiratory viruses, we do see that the immunity usually lasts a few months, but maybe not completely for many years, maybe a year, so it varies. There's other kinds of viruses we know about, respiratory viruses, where we see that the immunity doesn't last forever. But this is definitely what we're looking to science and studies around the world to better understand.
So I guess even if you have tested positive and recovered, we still carry on with the pretend you have it mentality and keep our social distancing.
Yeah, I would say right after someone's recovered, there's good evidence that they're not infectious. So we do let people go back to their normal lives 14 days after they started to feel sick. So they started to get a cough or a fever 14 days later. Or if they still have symptoms, we have to wait longer. So if they still have a cough that's, a new cough, we go 24 hours past the end of those symptoms. But there's evidence that at that point they're not infectious to other people.
Okay, great. a lot to learn as we go through this. Okay, so we're running short on our time. I could spend the whole day talking with you, Dr. Etches. Just a couple more questions, if I may. Turning back to the issue of visitors in a condominium corporation, and particularly the idea of managing risk. This comes with a lot of tricky issues. For example, children wanting to visit elderly parents to help them out. But even more particularly when it comes to personal support workers. For today's purposes, we don't necessarily have a definitive definition of what a personal support worker is, and I've taken a look at the various websites that are suggesting that personal support workers limit their care specifically to medical needs. So one of the big questions we're having in the industry is for housekeepers or cleaners. In some cases, the cleaner may be there as a help. In other cases, it may be due to mobility constraints. So we're wondering if you had any thoughts on personal support workers and housekeeping.
Yeah, so first of all, I just want to thank personal support workers. You know, they are out there on the front lines providing essential care in many situations, and we appreciate that and need to support them. We are asking people to limit their care to essential care, so that people should be you know, trying to do their part, you know, in terms of thinking about whether that service is essential. Cleaning is important for health as well. So, you know, that can include, you know, essential services can include maintenance and cleaning. We are looking, you know, to try to decrease the visits as much as possible. So like with grocery shopping, we say try to go once a week instead of every couple of days. And, you know, the same kind of approach I think is being applied in terms of personal support. You know, can you spread out those visits to decrease the risk? Yeah.
Okay, I know at the end of the day, I've suggested to some of our community that, as you've said, cleaning is important. We need to have a safe and sanitary environment. So to the extent that someone can't do that themselves, working with their personal support worker on an acceptable schedule to reduce risk would make sense. Yeah, agree? Okay. So now we're looking at current modeling from Ottawa Public Health appears to show that we may be looking at some reductions by about the end of mid-May. In the context of condominiums, do you have any ideas on thoughts on reintroduction for residents of common element facilities? Any facilities that maybe we should look at opening first or last? If you had any thoughts on that?
Well, to be honest, I haven't specifically thought about condominiums yet, and we will be looking at all of these different environments as we think about where we can relax restrictions. So this is going to be something that's a federal, provincial, local conversation in terms of how we go about relaxing restrictions. I want to tell people, yes, we see some good signs that hospitalizations and ICU, the intensive care unit admissions, are fairly stable. They're still not going down. We want to see that drop. But we're not through this yet in terms of why we started. We started these measures that are hard to maintain because our healthcare system could be overwhelmed with the number of infections in our community if we're not careful. And our healthcare system still isn't ready yet. They've been working hard. They've built beds. They've added ventilators. You know, we're managing right now. This is good territory that we're in because everyone's doing their part. But we need to make sure they have a regular supply of gowns and masks and visors, and that they can deal with a surge of infections as we relax restrictions. So we have to keep it up a bit longer. There are other things we need to have in place, like being able to test, you know, people and find infections and you know, do the case management I described for anybody who might be infected. And this is going to be something that I hope to have more dialogue with you and others in terms of what makes sense, what are the needs in the population, how do we go about, you know, fairly reintroducing more freedoms.
That sounds like a good plan. And I think for now, the best plan is, as you said, we all need to stay home. We all need to isolate, and we need to help keep crushing this curve. So Dr. Etches, if you have any final thoughts just before we move over to Superintendent Ford, I am going to ask afterwards if we can follow up with you. We'll get all the resources you've mentioned, as well as any other resources for other people who may need help with mental health issues or other stressful events. Any final thoughts before we turn over to Superintendent Ford?
I just want to thank you for organizing this and thank your participants for caring about how we can best look after each other and protect ourselves and protect others. It really is inspiring to see how people want to do their part. Thank you.
Thank you so much for coming, Dr. Etches, for sharing your time with us. And if you have time to stick around, please do so. Otherwise, I wish you a terrific rest of your day. Thank you. So we're going to move on now to our next local superhero, Mark Ford, who is the Superintendent of Frontline Operations, which includes all frontline officers, Emergency Services Unit, the Airport Policing Unit, Bikes and Beats Unit, Incident Command, and Emergency Management Programs. And on top of all of that, Superintendent Ford is very actively engaged in the community as the chair of the board of directors of the Snowsuit Fund of Ottawa, works with executive of Ottawa Blues Fest, and the list goes on. So again, I invite you to fully review Superintendent Ford's bio on our website. I can't keep up with them. Superintendent Ford, again, thank you. I can't thank you enough for taking the time to be with us today and help guide our condominium community through these challenging times. So welcome.
Thank you. Welcome. Glad to participate.
Thank you. So I'm going to start right off and dig into one of our tougher questions. As we talked about previously, we're all aware by now of the requirements for quarantining and physical distancing, but not everybody is listening as much as perhaps they should at times. So if management or the board of directors or a neighboring owner in a condominium unit become aware of or feel the need to report someone who continues to ignore all requirements for self-distancing or quarantine, one or the other, or does not practice safe use of the common elements, should we be contacting police directly or bylaw? What is our best approach to this?
Yeah, I think first off, it's important to speak to kind of what is the legislation that the police or bylaw will be working with. So as a result of where we are today, we find ourselves with a couple of amended pieces of legislation. So and I'm going to go about it by speaking to each of them. So that I think Dr. Etches spoke to the Federal Quarantine Act, and really that's the only sort of legislative authority that we have as it relates to quarantine. And we got to be very clear in our understanding of that. And that only applies to those people that are returning to Canada, and there is a legal requirement for people to self-isolate for 14 days. So there are powers afforded to police officers or peace officers, which includes our bylaw officers, to enforce that. But when we talk about the general context, if you haven't returned or you aren't COVID positive, the powers, because someone may not be feeling well or they're not practicing self-isolation, there isn't very much power in regards to that. The second piece of legislation, and I will come back to the enforcement piece, the second piece of legislation is powers that we find under the Emergency Management Civil Protection Act. And those powers, I think, in a very plain language, relate to the requirement that people don't congregate in groups of greater than 5, unless there are circumstances such as family, as well as the closure of certain businesses in the community. Again, there are powers, and there are enforcement powers afforded to the police and to the bylaw. And part of those powers include the opportunity to lay fines if warranted. So I'm going to come back to the enforcement because this is a very critical piece, and I think Dr. Etches spoke to it, is that although those powers do exist, we are taking the approach, that being police, as well as our city partners, and I know this audience is greater than the city of Ottawa, and I am in daily conversation with my policing partners across the province, and all of us are aligned in that it's educate, educate, educate. So whether it's a police officer responding and or a bylaw officer responding, depending on the jurisdiction, we are taking that education approach. Having said that, we are finding ourselves in circumstances that some people, for whatever their reason may be, do not respect that law and the intent and the spirit of why it is there. And we do have the capability of enforcing. We've seen it in the local context here in Ottawa, and we have seen it elsewhere in other cities across the province of Ontario, and for that matter, Canada, where enforcement has been done. And that is typically through the means of a fine and a ticket. So having said that, I think the question was, what could a resident or a person that's involved in a condo corporation do? Certainly, if, we would encourage the community to police itself and have those conversations and educate, because there's an assumption that all are aware, and sometimes that's not the case. Having said that, we also don't want people to find themselves in a compromised position where they're jeopardizing their safety, and that's why bylaw and the police are there. So if they feel that it's warranted, please do make that call. And each city is going to be different, but in the Ottawa context, it is through 311. And then a bylaw officer will attend, and or in certain circumstances, the police will attend. And again, coming back to that approach is that we are going to take that approach of having those conversations, educating the community, those members, and hopefully the outcome that we get is that people do respect self-isolation, maintaining physical distance where it is required.
Terrific. I think that will help a lot of our board of directors and managers to know that you are willing to come onto the condominium property to have those discussions, because they were nervous at first. I think some that you wouldn't be able to do so. So that's just terrific. Thank you.
Yeah.
So, sorry, go ahead.
No, absolutely. And you know what? And I think a lot of condo corporations, whether it's local or otherwise, we have our community police officers that are still in business, and they're out there and establishing those links through community associations. And I would encourage, to maintain those connections during this time. It is a different time, and we can leverage those officers and use them as an information tool or education tool to have those conversations, just like we're doing today.
That's actually
some virtual medium.
That's a great resource. I wouldn't have thought about that. So I'll just remind all of our participants to reach out to their local officers. And if education is needed, maybe that's a resource that you can tie on. So I'll turn then to our next question is, many trades do provide essential services to the condominium corporation. And we understand that the trades in some cases are being stopped en route to certain locations and asked what the nature of their business is, just to ensure that enforcement is being widely accepted. Is there any documentation that the condominium corporation should consider providing to their tradespeople, which would assist the police officers in determining whether or not it's an essential service?
Yeah, that's a really good question. There is a real tidy, easy answer in regards to that. All I would say is, a good dose of common sense for whether it's the tradesperson or the condominium corporation person, just to ensure that they have some means of identification. That can take many forms, whether it's a business card, a letter, any of those things. There is no, I think, definitive regulation that prescribes what that would look like. So as I said, it's not a nice tidy answer. Again, if the police or the bylaw are involved in regards to a call for service like this, they're going to exercise their common sense and discretion in managing those types of calls. I know, here in the Ottawa context too, it's I know this isn't part of a question, but we do have the situation where Quebec has put in different measures for those that are crossing between communities or crossing the bridges over into the province of Ontario. And there are exemptions there for essential workers that need to commute. And that same direction is being provided to them, as that they are deemed an essential worker and need to commute and cross a bridge, is, to carry a piece of identification, a letter, a letterhead, a business card, something like that can demonstrate that, they are considered an essential service.
Terrific. So for the participants, a letter on their own letterhead and a letter from the condominium corporation, those two documents with a piece of ID may be helpful in assisting the police officers. Great. Well, I actually do live in Quebec, so I'm experiencing I had to cross the bridge recently for an essential service, and I was pleased that I was able to provide the necessary documentation to the officers. So I think those are our two key questions that we had for you. Unless you had any other helpful thoughts or comments that you can leave us with at this moment in time?
No, I think, again, from an Ottawa experience, is that the community is doing a terrific job. And it just speaks to the strength of our communities, and it's nice to see that so many people be taking this matter seriously. And it's really nice to see is that we don't have to wear that enforcement hat. And I think that speaks to, you know, just everybody, including the people that are involved in this call, is they're great measures and the great strides that Dr. Etches spoke to that we've been able to achieve through these efforts.
Well, Superintendent Ford, thank you again so much for taking your time. Those are very, very important questions that we have been getting across the board from the community, and I know that that practical guidance is going to really help our boards and managers on this call. So I do hope that perhaps if we have more of those types of questions, you'll be happy to join us again. So
sure.
Thank you very much. Please do stick around if you have time. We're going to turn now to our third and final superhero for today. Our next superhero is a familiar face for those who have attended previous CCI events, Acting Division Chief Gwen Lewis. As with our other speakers today, Division Chief Lewis has an impressive bio, but she is most passionate about having created Ottawa's first obtaining and maintaining fire code compliance program for building owners and the very popular @Ottawa Fire Prevention Twitter account. I know I follow it and I think it provides fantastic guidance and advice. So Chief Lewis, thank you for starting that. Chief Lewis is all about education. And to that end, again, we thank you so much for taking the time to join us here today. Our time was, I think we're right on time, so we've got our full 10 minutes with you. So we'll jump right into our key questions that we have for you. This is an issue that we're getting a ton of questions about throughout the industry, and I'm really hoping you can help us through this. Are there any guidelines, extra information, thoughts, or comments that you can provide to us today, or which we could circulate later to condos? In the case of an emergency which requires a full evacuation of a condo building with no physical distancing possible as residents use the stairways. I know you think about, okay, well, getting COVID-19 or getting out of the building, I'm just going to want to get out of the building. But there may be steps that you can help us with. In such a case, would FireLink with Public Health to follow up with residents, monitor to determine what's happening afterwards? What are your thoughts on this, Chief Lewis?
So your evacuation during a fire alarm is all based on your fire safety plan for the building. So most fire safety plans either allow your residents to stay in their unit and or evacuate. So if you hear the sound of the fire alarm, leave your unit, close the doors, leave near by the closest exit and go to the stairwell and then go outside. Yes, I understand social distancing in the stairwells will be difficult, but once you're outside, get away from the building and then practicing more social distancing. Also, like Dr. Etches has talked about, if you can not use the handrails, because that is common areas, or even if you can put on gloves or some protective equipment as you leave, just to protect yourself. And then once again, no touching your face. When you get back in your unit, wash your hands with soap and water properly.
Okay, so that's a good tip, actually. So perhaps one thing to be thinking about is having a little emergency kit put right outside, right by your front door in the event of an evacuation, which would include your gloves, which would include your mask, and maybe include a copy of the the evacuation plan. Would you think that at this point in time would be a good idea for the condominium corporations to be reevaluating their plan, or perhaps getting in touch with someone from your office to ensure the plan is up to date?
So your condominium board or your supervisory staff is required to review the plan on an annual basis to make sure it still meets their needs. And changing the evacuation procedures now is, I'm going to say, not different than any other time of, I was going to say, our lives. Mm-hmm. It's just, I'm going to say, a little more predominant now since we are in the crisis.
Okay, great. The next big issue we're getting questions about is fire alarm testing, both in the units and on the common elements, whether we should put it off, whether we can do it. A variety of different questions on that aspect. Chief Lewis, what are your thoughts?
So the Ontario Fire Marshal has not come out and relaxed any of the Ontario Fire Code requirements. So Ottawa Fire still states that building owners, and that includes condo management board of directors, are required to maintain their buildings as per the Ontario Fire Code. Fire techs and sprinkler techs have been deemed an essential service. So annual inspections can continue or are required to continue. Where it, I'm going to say, can become an issue is when entering units.
Mhm.
So newer units will have heat detectors in the units. There is a provision in the standard that they can forego unit inspections for a heat detector. That's not a smoke alarm. That's connected to your fire alarm system. And that should all be discussed with your fire alarm provider. When it comes to smoke alarms that are required to be tested, some of these are contracted out to a fire alarm specialist. Different landlords and or condo boards are doing them differently. Some they're requiring the individual owners or tenants to test them. Sometimes the alarm tech is outside and somebody in the unit has to just test it, and as long as they can hear it, it is then documented. Also, condo owners, I believe it's their requirement to test their own smoke alarm because it's within their unit. So that's your local smoke alarm that would sound if you had burnt toast or indeed if you did have a fire.
So there's a variety of different mechanisms that each condominium corporation can think about. And so the recommendation would be to contact your provider, or if necessary, contact your department to make sure that they are continuing with their compliance, because the compliance continues to be mandatory.
That's correct.
Okay, great. Thank you, Chief Lewis. And another very interesting question that we've heard from some in the community, and this relates, of course, to the fact that some of our condos are aging buildings and have recently undergone a lot of inspections. And in some cases, Ottawa Fire Services has issued mandatory orders to some older condominium corporations to upgrade fire alarm or suppression systems to meet newer code requirements. This, of course, was all done in the before, as some people have called their situation now. Given that such work may be invasive to interior residential units, or there may be situations where you can't get into them, is there any talk of there being a suspension of the timelines for completing this work?
So that will all depend on the situation, like an individual situation per unit. I know there's many throughout the city of Ottawa are ongoing now, and they are large projects like replacing the whole fire alarm system. Some of the contractors themselves have put a different timeline on items because they don't want to enter the system. So they already have a working system in place. They're just looking at upgrading it. So once again, it's working with the contractors for those items.
Okay, so because the condo and the owners could be jointly held responsible in the event that things fail, would you recommend that the condo work with the contractor NOFS if their timelines are coming up, to make sure that in the event that any timelines need to be extended, they could get that?
Yes, I do agree with that. So any time if you're working on a project like this or have a project ongoing in your building, is contact the fire prevention officer that's already dealing with the situation.
Fantastic. And we just have a participant who asked for just a wee bit of a clarification on the testing of the speakers, the audio in suite. I guess in some cases the technician can stand outside the door, the owner can test it, and the technician would be able to hear it. Is that what could happen?
So that would be for a smoke alarm.
So
not a speaker.
Okay.
And not your heat detector. So your smoke alarm could be a battery operated device or something that you would change your batteries in, something that you should be testing on a monthly basis, usually by pressing the test button.
Mm-hmm.
So there's also a requirement to test it on an annual basis. So that's where maybe the resident can test it within the unit, mm-hmm. and then the technician be outside. And that's only one suggestion that has kind of, I hate to say, crossed my desk.
But it may be a great one in some cases where we can't get into the units. So Chief Lewis, again, these are really important questions that we've received in the community, and so I thank you very much for your practical guidance on this. And we're right at 1 minute to 6, so we've done well to keep in our timelines. So I just want to start to close us out by saying that I can't thank all 3 of our local superheroes enough for having taken their time out of their incredibly busy day. Superintendent Ford, I invite you to turn your video on. I think unfortunately Dr. Etches did have to leave us. She is an incredibly busy woman these days. And so again, from the bottom of my heart and from all of our participants, I thank the 2 of you and Dr. Etches for taking the time out today. A recording of our webinar today will be posted on CCI Eastern Ontario website as soon as it is available. Hopefully you'll watch it if you're interested, and I do hope that you will all return in the future, as I'm sure we're going to get more pressing and continued pressing concerns. I'll just take a quick moment to give a few shout outs. If you're not already a member of CCI, we hope you would be contemplating joining us. We would be delighted to welcome you as a new member. We also hope to see everybody in a few weeks, and Chief Lewis and Superintendent Ford, you're more than welcome to join us. So we have a virtual beer and question session coming up, so if we have some more questions from you, we'd be delighted if you could join us then. In the meantime, CCI Golden Horseshoe chapter is also hosting a seminar in about an hour from now, from 7 to 8:30, and they've titled theirs Living in the Twilight Zone, and a somewhat apt title at this stage of the game. A special thank you to our Q&A team, Justin, Richard, Shelley, and Andre, for managing our questions. And until next time, on behalf of the Board of Directors of CCI, all of our participants today, be safe, be patient, be kind, and above all else, stay home. Please do your part to protect our essential workers that are out there on the front lines, putting their lives at risk on the line to protect and help all of us and those who are medically compromised. Stay in your homes, stay in your unit. We heard that today, unless it is essential to leave your home for food or medication. Let's all work together and crush this curve. And from the CCI family to your family, we wish you all a safe and healthy rest of the week. Thank you very much.
Thank you.
Thank you.